Abdi can present himself also. You know my name, Muhammad. I work at the Montreal General, the same as Zain Abidin, it's on Guy Street. I work at the Central Laboratory, which is basically 3 or 4 labs right now. It's not a core lab. And we basically do blood tests, blood analysis, stool analysis, urine analysis, skin analysis, bacterial analysis. All the analysis that you can think of is done in the labs. Genetics, biochemistry, hematology, coagulations, all the analysis you can think of. I've been working there for at least 11 years, and currently I am a temporary technical coordinator, which is going towards a manager in the lab. I'm also studying at McGill, as you may know, in healthcare management. I'm doing a graduate certificate in McGill. I'm doing this more part-time. So, Zain Abdin. Huh?
So you guys all know name Zain Abdin.
So your name, say your name.
I'm just a medical imaging technologist at the Montreal General with Brother Muhammad. Pretty much it's only my first year, not 11 years. I have a long way ahead until I can reach Muhammad's experience. It's my first year as a medical imaging technologist, and there's a lot of different places that will go throughout in the hospital, and I don't want to speak too much about it because I prepared some slide, and when I present my slide I'll be able to talk more about what my field is, what and where I can work throughout the hospital, and where my career could actually take me. And at the same time I'm doing continuing my studies at Korea University.
Okay, so we're going to start the presentation. أعوذ بالله من شر الشيطان الرجيم بسم الله الرحمن الرحيم ربنا إنا سمعنا مناديا ينادي للإيمان أن آمنوا بربكم فآمنا ربنا فاغفر لنا ذنوبنا وكفر عنا سيئاتنا. Basically, I started with this ayah because I want to make a relationship. I've spoken about it a while ago. I want to make a relationship between the field, the career that we do, and this ayah, which is the iman. It talks about the iman and maghfirah. And basically, you can understand at the end what's the connections. So our hidden fields. When you're sick, when you see the doctor, you go to see your GP or general practitioner, family doctor, and he gives you a requisition for maybe, let's say, a blood test, a urine test, or maybe have an x-ray for your lungs. You have a strong cough, and you just can't resist anymore. You have to go because you're sick. So that tells you how complex our body is. Obviously, our body is not just one full piece. If you open up a human body, it has a lot of organs, a lot of functions, and within each organ, a lot of details. There's the genetic parts, there's the biochemical reactions inside the body. So it's quite complex. So how do we evaluate our health, being healthy and not healthy? That's what we do at the hospital. We do measurements. We can measure our healthiness at the hospital. Okay. Do we have a choice? If we get sick, really sick, do we have a choice not to go to a doctor, or at least the emergency? I guess a lot of us, or everyone, don't have a choice. Why do we want to stay as healthy as possible? These are questions you guys need to think of. Our existence, our body, our soul. what's the relationship. So what do we care about? Do we care about our body, or do we care about our soul, or we care about both? When we're sick, when our body is sick, we go to the doctor. When our soul is sick, a lot of us probably don't do anything, just keep on the sickness. So what do I do when I get sick? Obviously I go to the doctor, he give me a requisition, or he give me some treatment, he give me medication, he give me a strengthful medication, like maybe extra strength Motrin, or stuff like Plavix. Why do I get sick? There's different reasons. You have pathogens coming, bacteria's getting into your body. Maybe you have genetic problems. You have cancer, or you have some let's say physical deficiencies. You have amputations. You have deformities, etc. And how do I get healthy again? Most of the time, it requires time. If you don't take necessarily a pill or a medication, or you don't get a treatment for a severe illness, it just requires time to set it up again. I spoke about this curve, and it's really important that you guys think about it between time and time. The curve of your of health, strength, and health susceptibility. This curve is what I noted. I put it. I indicate this is the body. We start at birth. We don't have a lot of strength. We're susceptible to infections, and when we die, also our strengths go down, and we're susceptible to infection. So this curve talks about the strength of your body. This straight line, which can go up and down, is your soul, and it goes down is the strength of your soul. If your soul is really weak, it's going to go down to zero, or maybe a bit more. And if your soul is really strengthful, it's going to go up. So also you notice that the curve has an end and a beginning, yet the soul line does not have an end and a beginning. It's infinity. So I'm going to talk about that at the end. I just want to bring this up now. So when we measure, when we get sick, we have means of measurement. We can measure our levels. Let's say if you have a high cholesterol, you can measure our level of cholesterol and see what's your level of cholesterol. If you get sick, we can have different measurement to diagnose your sickness. So that tells us that the body has a certain limitation, and this is proven by the curve that I just presented, that we start at birth and it ends at the death. Yet the soul, it's illimited, it's infinite. Okay, so basically you guys saw the kind of complexity of measurement. So we have different labs measure different things, and these measurements are actually our body measurement depending on our sickness. So that also tells us how complex we are, and how Allah subhanahu wa ta'ala have created us in a quite complex artistic way. Why artistic? Because there is a quite symmetry, cohesion in the body, that everything works within a system that is so complete, so perfect, and extremely delicate in terms of life and death.
Other modalities than just plain X-rays, such as MRI, CT scan, and ultrasound. How many of you are aware of different modalities, or have had a medical imaging test, like an X-ray, or you've had an X-ray before? Mm-hmm. What type of X-ray?
CT scan.
A CT scan? You had a CT scan?
I think so.
I'm just doubting because
No,
you're too
because
young
I
right
had a
now. That's why.
concussion, like way before. So
Okay.
they just checked like the X-ray of my brain or something like that.
Okay,
So I
yeah,
don't know.
usually. Okay.
It's some same thing. I'm not sure.
So okay, so you're aware of what a CT would be different. Okay. Anybody had an ultrasound before? I wouldn't want to know what before, but raise a hand. Ultrasound, an X-ray, just a plain image X-ray. Yeah. You broke everything before, so. All right. So here it is. Just start off the duty of what a medical imaging tech does. First, we go to school for 3 years in Quebec. It's in college. It's a college degree only in Quebec. Otherwise, it's a university degree. So what it is, just we need to have the knowledge and skills for the examination. So what I mean by this is basically we need to know what the body is inside, most of it. So if we take a skeleton, we need to know it all by heart, piece by piece, every little, the bone, mostly the bone. That's what we start off with. We start in X-ray. We start off with the bones, knowing the bones in detail. When we start the examination, we need to make sure the patient, the person coming in, is comfortable during the exam because we want to minimize the radiation. It's another duty that we have, actually, just minimizing the radiation, not just for the patient, but to the general population as a whole. So if your doctor requests an X-ray and it's not necessary, then we will not do it. There's a long protocol to follow before actually making that decision. Also, we do work with many different types of doctors in different examinations, so it's not just towards knowing what's wrong with the patient, but also there's some therapeutic exams. So there is sometimes we will put injections to relieve the pain in a patient. And the final thing is really just to review our final films before our final images before sending it to the radiologist. I'd just like to make a distinction between a radiologist and technologist. Technologist is the one who gets all the images ready. A perfect image for the doctor to read. A radiologist, he's the doctor. He's the specialist that would read the films. So like I said before, our skeleton here, we need to know it inside out. As complex as it seems, when we go to school, and it's a bit easier when we learn in school than just looking at it. It's really knowing the different details of bone, and once you learn the skeletal system, we start imagining it in us. So when we have somebody come in with that needs an X-ray, we need to know which part of the body it is that we're going to X-ray, and how the image should look like, and what is a normal position, what is a normal view of a bone. So if you have, let's say, your forearm is like this, and we see on the X-ray that one piece of bone is on the other side, then we know there's something that is abnormal, that is not normal there. At the same time, other than the skeletal system, we'll start also at the same time we learn about different systems in our body. So our digestive system, the nervous system also at the same time, and there's the lymphatic system, many other systems also. We need to know, just have a general knowledge. So we do dynamic studies, we do studies that require us to see. So I think on the video that I showed you, they showed you somebody drinking. It's what it's called is the barium. It's a white liquid that we drink. It just enhances your digestive system, so we can see if there's any type of pathology in there. And that's what it would look like. That the upper part is actually the stomach, and there's definitely something wrong with this patient. It's not. It's usually your intestines come after the stomach, but there's probably a block there. So as a general X-ray technologist, once we graduate, we'll work definitely in X-ray right away, because that's what we're mostly trained for in our 3 years of studies here. So we need to get basically any part of the body that the doctor requests. We need to get a frontal view and a side view of the X-ray. And this is actually a leg, and this would be a side view, and it has to be more of a perfect side view. We should know how a perfect side view looks like, and this would be a frontal view. No, for the side view, it's not really perfect. I won't explain to you why it's a bit complicated, but you can see